Alcoholism, a chronic disease marked by an inability to control alcohol consumption despite negative consequences, affects millions globally. It's a labyrinth of behavioral, psychological, and physiological factors that weave together into a complex web. In this video, we are going to explore the reasons behind alcohol addiction, its stages, and the alluring nature of alcohol for addicts. We will also explore the concept of hitting rock bottom, the science behind addiction, different treatments available, and a glimpse into the history of alcoholism treatment. The allure and addiction of alcohol. So why do people become addicted to alcohol? The answer is multifaceted, involving genetic predispositions, environmental influences, mental health disorders, and social factors. Genetics. Research indicates that genetics account for up to half of the risk of developing alcoholism. A family history of alcoholism often predisposes individuals to develop alcohol use disorders. Environment. Growing up where alcohol use is prevalent and normalized increases addiction risk. Stressful life circumstances can also drive people to alcohol as a coping mechanism. Mental health disorders. Conditions like depression, anxiety, and PTSD correlate with higher rates of substance abuse, including alcohol. Peer influence, social and cultural pressures can significantly impact drinking behavior. The need to fit in with a peer group that consumes alcohol regularly can lead to increased use and potential dependency. For someone addicted to alcohol, the substance offers a temporary escape from unpleasant emotions or stress. Alcohol increases dopamine levels, the feel-good neurotransmitter, which gives feelings of pleasure and euphoria. Over time, the brain becomes reliant on alcohol for these sensations, making it daunting to quit. Exploring the stages of alcohol addiction. Alcohol addiction doesn't happen overnight. It typically progresses through 4 stages. Pre-alcoholic stage. Drinking mainly occurs in social settings or for stress relief. Negative consequences are usually minimal at this point. Early alcoholic stage. Drinking becomes more frequent and memory blackouts might start. Individuals may begin to drink secretly and develop a tolerance. Middle alcoholic stage. Physical dependency develops. Drinking becomes more noticeable to others, causing social, work-related, and relational problems. Late alcoholic stage. Drinking dominates the individual's life, overlooking almost everything else. Severe health problems, social issues, and legal troubles arise. Drinking continues despite these severe consequences. Alcoholics versus problem drinkers. Understanding the difference between an alcoholic and a problem drinker is crucial. An alcoholic has lost control over their drinking, leading to addiction. They experience withdrawal symptoms in the absence of alcohol, have a high tolerance, and continue drinking despite knowing the harm caused to their health and life. In contrast, a problem drinker may not meet all criteria for alcohol dependence, but faces significant issues due to their drinking habits. These individuals might drink excessively and encounter problems at work, in relationships, or with their health, yet retain some level of control over their consumption. The rock bottom experience. Rock bottom is a term used to describe the lowest point in an alcoholic's life, where the negative consequences of drinking are most severe. This might involve losing a job, facing legal troubles, damaging relationships, or encountering severe health problems. Hitting rock bottom often becomes the critical turning point for seeking help and starting the journey towards recovery. The science behind alcohol addiction. Alcohol impacts brain chemistry by altering neurotransmitter balance. Initially, alcohol increases the effects of gamma-aminobutyric acid or GABA, leading to relaxation, while decreasing glutamate, which heightens brain activity. This dual effect makes users feel relaxed and uninhibited. With ongoing exposure, the brain adapts by reducing GABA receptors and increasing glutamate receptors to maintain balance. This adaptation results in tolerance, meaning higher amounts of alcohol are necessary to achieve the same effects. Upon reducing or stopping alcohol intake, the brain's heightened glutamate activity leads to withdrawal symptoms due to the diminished inhibitory effect of GABA. Treatment paths for alcoholism. The treatment of alcoholism has substantially evolved, embracing a range of approaches tailored to individual needs. Detoxification. This initial step involves cleansing the body of alcohol. Medical supervision is often necessary due to the risk of severe withdrawal symptoms. Counseling and behavioral therapies. Techniques such as cognitive behavioral therapy, CBT, motivational interviewing, and family therapy help individuals understand and change their drinking habits. Medications, drugs like naltrexone, acamprosate, and disulfiram can help reduce cravings and diminish the pleasure derived from drinking. Support groups. Organizations like Alcoholics Anonymous AA offer peer support and structured recovery steps, providing crucial community support. Inpatient and outpatient rehabilitation. Intensive treatment programs provide comprehensive support services, including medical care, counseling, and life skills training. A reflection on the history of alcoholism treatment. The history of alcoholism treatment illustrates the journey from moralistic to medical perspectives. Early treatments were often punitive, viewing alcoholism as a moral failing. The 19th century temperance movement sought to curb alcohol consumption through moral and social reforms. By the 20th century, a more medicalized view emerged, recognizing alcoholism as a disease. The founding of AA in 1935 revolutionized recovery by providing a community-driven process. Over time, therapeutic approaches and medications were developed, showcasing deeper understanding and compassion for the biological and psychological aspects of addiction. Navigating through alcohol addiction is undoubtedly challenging, yet recovery remains within reach with the right support and treatment. Understanding the intricate dynamics of alcoholism, from its causes and stages to the science behind it, empowers individuals and communities to approach this condition with compassion and efficacy. The history and evolution of treatment underscore the progress made, reflecting the optimism and resilience required for a healthier, sober life.